So this demonstration project ends in the fall of 2016. In April, we received a planning grant from the Hartford Foundation, which is designed to help us figure out what the next steps are. So over these last few years, we've demonstrated that this academic, community, government partnership can work. We've sustained our relationships with these nursing homes over these last years. During this time, we've also heard from other nursing homes in the area asking, when are you going to come and work with us? And that's very exciting. So now we have very much been thinking about sustainability and how can we expand what we've done and what we've learned to reach more nursing homes, especially within Indiana and regionally. So this planning grant gives us resources to evaluate our own program, to figure out what pieces we could take forward, as well as start looking at developing a business plan for how we would do that, developing a roadmap for that. So we're very excited about those new resources to start thinking like that. And certainly our staff that we've hired for this are very interested in that, but as are our nursing home partners and the other nursing homes in the area. So we're really excited about the what's next piece of this project. We certainly have loved the advanced care planning, the Interact tools, the proactive chronic disease management. We're expanding our polypharmacy, which is a really big deal in this area. And then our nurse practitioners do transition visits on everyone who comes back from the hospital, and they have found tons there. The question about going forward is what the model would look like. Are we going to put people full-time in nursing homes? Would we train different people within the nursing homes to focus on different aspects of this project? What resources, it's one of your first questions, what resources can nursing homes bring to bear in this, and what can we give them? How does that look? Also, health systems who are partnering with nursing homes, paying attention to their readmission rates, would health systems invest in quality programs like this that we are proving can reduce hospitalization rates? Also, I mentioned there are 6 other sites in the country who are doing this initiative. Their programs have some differences from ours, but overall more similarities. We have a very open dialogue with them, and we'll continue to think with them about what the next steps could look like. As I said, these models are more similar than different. But there are important differences. Some are all about providing direct care. So going in there, seeing patients and trying to deal with acute change in status. Some of them are consultation only. They train the nursing home staff, but they never touch a patient or talk to a family member. And then we're both. So we're doing both direct care and indirect care, where we're training and increasing the capacity of the nursing home staff to provide better care. So yes, CMS, with all of the Innovation Center projects, is doing an evaluation. So they have a contract with an external evaluator to evaluate all of these models. And hopefully the entire initiative will be successful. And to the extent that they can pick out where places were more successful or less successful, that would be great in terms of helping shape a final model that perhaps CMS would help directly scale up. The reality is that takes time, and it will certainly take time for the evaluation to happen. They use claims data, and so there's a minimum of 6-month lag on that. And so by the time they get all their data and they analyze it and they publish it, and then CMS evaluates it and makes a decision, we locally here will have moved on. And we don't want to move on, we want to keep going. And so that is our plan, that we are going to take what we've been learning and scale up here as we wait for CMS to more broadly implement what we've all learned collectively from this. I don't think any of the 7 of us see it as a contest. It's a very collegial group of people. They all wrote us a letter of support, actually, for this grant that we just received. And we are all vested in this world and improving nursing home quality. And so we've been really working together on this. One issue was it was hard to have a lot of rural sites because you had to have an average of 100 beds or more, and also you could not have high managed care penetration. So that knocks some regions out. And also your state government had to write you a letter of support. So the Medicaid office and your survey and certification, which was no problem here. We have strong relationships with Indiana state government, but I know was an issue in some states just given other things going on in the state. There is a mix. There is a mix of urban, suburban, and rural. We are all urban and suburban. Some of the sites have challenges we don't have. Nevada, their sites cross the whole state. I mean, they have 8 hours between some of their sites. Ours, I mean, it feels pretty far to drive from the north side to the south side, but you can do that in a day. And we pull our nurses together very regularly, twice a month for trainings. And we have had very low turnover in our clinical staff. And I think a lot of it is because they have been a cohort unto themselves and, you know, as well as part of embedded in their nursing facilities. But the sites or the states that their sites are more far-flung, that has been a real challenge for them. So there, as I said, there are similarities and differences among the sites, and we've been learning from each other and sharing tools throughout the initiative.